We want to congratulate the king of Toro, Oyo Nyimba Kavamba Iguru Rukidi, upon reaching his 28th coronation. And we pray that may God enable you rule the people of Toro wisely. And all the people of Toro, we congratulate you upon reaching this day. It is a memorable day, especially for you, for the kingdom, because he is the youngest king. And we are indeed proud of him. And this is the Family Hour. I want to welcome you to today's edition of the Family Hour. Today is a Tuesday, and Tuesday we discuss family health, and we want to enrich your family. We want to enrich you as a family, especially in line with health, because if you're healthy, then you can do everything you can, and you can achieve your goals. If you are healthy, if you're not healthy, then there is a problem. You'll spend a lot of money in hospitals. That is not what we want. We want you and the entire family healthy. Now, a lot of things have happened in the world, but we thank God that we are alive today, and God has enabled us to see the beauty of this day. And I cannot forget to thank you so much, you who is watching us right now, you who has decided to learn with us here on the Family Hour, especially this Tuesday edition, where we are going to discuss a very pertinent issue. Therefore, are you a parent, or are you a child? I know this is a holiday, so children are home. Please sit and listen, because this is concerning us, the children, directly. But Edwin Austin Mukalazi is my name, and today we are glad to have Dr. Brian Rushaju again with us. He's the director of RAN Foundation. He's a dentist, and we are discussing dental diseases that affect children. We want to basically look at children, because we understand next week they'll be back to school, so it is important to discuss this before they go back to school, so that you as a parent, you know how to manage some of these problems, and in case they need to visit a dentist, you take them within this time that they still have with you at home. Doctor, you're most welcome this evening.
Thank you very much for having me.
It's a pleasure having you once again, coming in to educate the nation. Thank you.
You're welcome.
Yeah. Kindly greet those viewers who are watching us. They want to hear from you.
Yes, good evening, viewers. I'm glad to be here again this evening. And thank you for tuning in from last talk and then today. You're welcome.
And if I can cite out a few aspects as we do a short recap of last week's edition, where we are discussing about the accessibility and affordability of oral health education. And very many people were concerned about some of the things we talked about, especially the toothpaste, the toothbrush, and also the brushing intervals. If we can pick it from there, just to wrap up last week's discussion before we get into today's discussion.
Yeah, so basically last week we talked about the two major problems that affect people, largely tooth decay and gum disease. And most of these diseases are coming because of not disrupting bacterial activity in the mouth. So we said that it is important to be able to clean. Bacteria is present in the mouth, and when you leave food, it is to get something to eat, and then it breaks it down to make what you call acid. Now, this plaque needs to be disrupted, and you can only disrupt it by brushing your teeth. So we said you've got to brush in the morning and in the evening. And when we brush, we said first brush without toothpaste. Brush with water and your brush, and remove food. Then rinse, make sure you pass your tongue around your teeth and all your teeth are clean. Then you can put toothpaste. The second time, wash your brush, put toothpaste, and then brush again. And we're saying do not rinse that toothpaste. If you have put toothpaste on your teeth, leave it. Let it work. Let it in a chemical reaction. Let the fluoride ions in that toothpaste move into the tooth in a chemical reaction. Then you can always spit as much as you can. If you want to rinse and you really feel you can't do it, wait a little bit. Don't rinse immediately. Then that toothpaste will be able to help you. And we talked about, of course, how you should keep your brush, how you can identify a good toothpaste, and so forth in order to have good health. But I emphasized that it is important to brush at night. Even when you forget to brush in the morning, we can forgive you. But at night, you should never forget to brush, because at night, saliva is not flowing. You're not disrupting the bacteria activity by talking and chewing and all these things. So bacteria has ample time to be able to work on your food that you have left there. So it's important to be able to brush at night if you want to have good health, oral health.
Okay, and I believe that message has been received as it is.
Thank you.
Well, Doctor, today we want to look at the children and the dental diseases that affect children. We understand they are in their evening of the holiday. Anytime, actually some have even started going back to school, but we know the official date is actually next week on Monday. And as we discussed this, I believe it comes at the right time, because very many parents actually tend to stock a lot of things for their children as they're going back to school, and some of these are even harmful to their teeth. So I believe you, a parent out there watching us, by the time we conclude this discussion, you will at least have known how to safeguard your child's oral your child's mouth and teeth and gums and all that. So I will get to now the commonest problems that children face.
Yes. So basically what we need to begin with is that children, we have two sets of teeth. So you have the baby teeth, what people call baby teeth, milk teeth. And that will come, maybe they start coming to the mouth at about 6 months. And these baby teeth, they will come to a number of 20. And when it comes to 6 years, you start removing them. They get out in pairs. So the two small in front ones, they will get out, and then they start getting out in a pair as they're being replaced by the permanent teeth. Now, the permanent teeth, that process goes on up to about 12 years. Some can go 13, others, about that time. And so many of the children who are going, for example, senior one, about 13 years, are just getting the full set of the adult teeth. Yes. So they because you keep removing the baby teeth, they are being replaced. The baby teeth are there to do the same functions as the adult teeth. They help the kid to chew food, help to talk and smile and all the things that the uses of teeth. Now, when they can't, God designed it in that way that you have smaller teeth because the jaw is small when you're young. And so it cannot accommodate all the big permanent teeth. So these permanent teeth will eventually come into the mouth as the jaws expand, as you grow, as your head becomes bigger, so it can accommodate. And you see that even what we call the wisdom teeth tend to come even much later, maybe about 20, 23, because the jaw keeps growing, and as it grows, it accommodates. Now, that's why that process is important. And that's why we are saying that all right from, actually before they even bring those first teeth, we want them to see a dentist. Then we can start advising. We can start being able to help and walk with you in order to understand what to do and what not to do. So you'll find that...
If you can pick it from there, why is it important that they see a dentist even before the process begins?
Yes, so now there are issues like, so first of all, when you're children, they may have problems like tongue thrusting. So they start thrusting the tongue, and that is going to have an impact on how their dental femur is going to be formed. There are those who are going to have problems like sucking the thumbs. That is something that tends to be normal when children are younger, up to about 5 years. But it becomes a problem when it goes past that, because you end up having like what you call an open bite. So the teeth will be formed, accommodating that thumb that you're always putting in the mouth, and you leave that gap, and that will be a problem. And there will be other issues like, of course, sleep apnea. There will be other challenges that kids may have, and which can be detected early, and then you're able to help this child from getting such a deformity or getting such a problem. But also issues to do with parents are feeding kids with bottles, because these are working mothers. They're busy, they leave milk with sugar, and the kids just sleep with this bottle of sugar and milk. You know, all that, we've got to be able to walk with them and advise them to know, what do you do? How do you clean? What do you do before the teeth come? What do you do after the teeth have come? But there are some of those mistakes. There are kids who fall sick, they give them syrups. Syrups have sugar and they are sticky, they stay on the teeth. And you find most of them get spoiled. You find the kid has lost almost all these baby teeth appearing black, you know? And so they don't know. They're like, well, we've been brushing. But they don't know that when they gave the syrup, they were supposed to actually clean, maybe get a piece of cloth and clean, or just give a kid water to dilute that. And also other mistakes of the love that we have for the children, and you're giving them sweets, you're giving them, and so that has got to go with something else that you've got to do. So like you're creating a problem, and we cannot stop that. As dentists, we cannot tell kids not eat sweets. That's going to be a very hard job. But we are saying, what should you do? Can you enforce as well? You've given a sweet, but enforce cleaning. Enforce and teach cleaning. So when you bring them early enough, then we're able to advise, we're able to work with you, we're able to detect. Because there are problems like that affects children called early childhood caries. And you find that in these early childhood caries, you're having a lot of decay on the teeth. And it's including surfaces that ideally wouldn't be affected in a normal person. So you find that all the teeth, almost all of them are affected. These 3/4 of the teeth are affected. Now, most of these things will be linked to something, will be linked to some mistake that is being made by a parent. And so it is important that when you bring them early, we're able to identify some of these things. We may have some solutions, and then advise you sometimes on what you should do. You're talking about the sweets and the things that the cookies that they're going to give the kids at school. Most of them actually, they get dental problems during this secondary school, because at night, the last thing they want to do is have a cookie in the mouth. The last thing, even maybe after brushing, they want to have daddies, they want to have a sweet and then sleep with that. And that is very dangerous. So there are quite a number of challenges that may affect these baby teeth, and even the mixed dentition, and even those kids who are about maybe 15, 16, who already have permanent teeth, and they're making some mistakes. Yeah, but some of the other dental issues that I wanted to talk about is that, of course, you're having the tooth decay, which we talked about extensively, and the gum disease. It will affect children and affect adults. And it's caused by the same problems, and it's going to be responded to in the same way. But we're talking about other issues that may be present and are important for us to be able to identify when it is still early. There will be things like there may be children who have some genetic problems. And some of these genetic problems may affect the way the teeth are going to appear, may affect the way they are going to be in terms of how they clean them, and all other challenges around that. Now, we find that if they're having, for example, reduced saliva. So reduced saliva, if you have reduced saliva, it means...
Is it genetic?
It can be one of the... Most of these genetic problems, it could accompany them. Now you find that if you're having less saliva, it could be that, it could be also due to maybe, for example, some drugs that you are taking. For example, children who are having HIV/AIDS, we realized that most of the drugs they were taking were causing this problem, reduced saliva. Or those who have had cancers and they are taking their chemotherapy. So this may affect maybe, for example, the flow of saliva. When that happens, they are going to have more caries or more attack on their teeth than their counterparts who are okay. So you find that it is sometimes actually when we see aggressive caries, it is a pointer for us to find out what could be going on, what could be reducing maybe this saliva. It could be something that eventually could help. There are issues, talk about like cancer. We have a very common cancer here that was discovered in Uganda called Burkitt's lymphoma. Yeah. Burkitt's lymphoma was actually found out by a British doctor called Burkitt's. And it is something that will affect the jaws, will affect somebody begins to have like big jaws. So somebody could be laughing at somebody. Kumbe, it's actually a very serious, problem.
And actually, that is it gave a genesis of how Uganda Cancer Institute was formed.
Yes. Yeah, and so you find that it is going to see dentists and going to find out what could be going on is so important, because sometimes you find you can discover a bigger problem, that you are not even aware of. And so things like Burkitt's lymphoma, these are very, because it's like the endemic part of it, which the endemic variant of Burkitt's lymphoma is common here in Africa, where there is malaria and of course Epstein-Barr virus. But you find that if you take things just for granted, you could find you're handling actually very severe.
What are some of these? What are some of the symptoms, so that someone can really know that when I see this and this and this, then I don't need to rest? Like last time, we talked about people who, when they feel maybe a toothache, they'll take a painkiller, kill off the pain, and then life moves on. So, what are some of the symptoms that can really be an eye opener to someone to rush and seek medical attention?
Yeah, well, of course, we're saying if you see your child beginning to develop, for example, lymph nodes, they are swelling in the neck region, you're beginning to see abnormal swellings that you do not understand, it's important to be able to rush to health workers and find out what could be going on. But we are saying there could be problems like reduce, and some of these are very hard to tell. That's why we're saying not until maybe because you may not have pain, not until actually the situation is in stage 3 or 4. And so going early begins to help. When a dentist takes a look and begin to see unfamiliar pattern, begin to see all sorts of almost all teeth are affected, then it rings a bell. And as he investigates, he maybe begins to look at the soft tissues and the hard tissues. He could have an insight into what could be the problem. And the investigations that he carries on could eventually help you identify some of these problems. But we have other things like molar incisor hypomineralization. This is a very common problem that's coming up, where the molars and the incisors are affected. So it's when the teeth are developing, that times, you kind of understand it when you look at the way we make concrete slabs. So you have this mesh that is made of iron bars, and then they come and pour concrete in it in order to make that solid block. So when teeth are being formed, they have that matrix that is formed, like the iron bars, and then eventually ions and minerals are deposited in. But sometimes when there is a disruption in that process, for example, if you looked at, if power went off as you are maybe pouring the concrete. So if there was a disruption, and this disruption could be things to do with for example, parents who take alcohol while they're pregnant, things like some medications, things like malaria, suffer malaria. And so there could be some disruptions that may affect the way the teeth are being formed and the way these minerals are being laid out. So you find that when they come up, they're having these teeth, especially those incisors and the molars, are they change color, they begin to break down, they disintegrate. And so you find that some of these issues, and the way you address them actually is not the same way like we usually make fillings for the other teeth. They handle differently. But what I'm trying to say is that all these things that may happen that we are not aware of, because for you see discoloration.
Yes.
But many people, because the discoloration is also not paining, many people will not mind. But we're saying,
and some people also tend to think it is normal.
Yes.
Maybe it is just a season. Maybe this is a season, it will pass, and we take it for granted.
Yes, but that's what we're saying, that if it is this MIH, if it is fluorosis, there are those who are concerned and will take the kids to the dentist, maybe ask. There are those who say, you're not having pain, leave it alone. But you see, as time goes on, then the tooth begins to disintegrate, begins to break down. Before you know it, there is no tooth, only the root is remaining. Whereas if you had gone early, you find that a dentist maybe may put a band around it, may put a crown on it, may do something in order to keep that tooth protected, because it is not able to bear the forces as you are chewing food, like the other teeth which are normal. And so some of these things are things that we are concerned about, and we think that parents should mind and be able to bring. There are kids who have things like grinding teeth at night.
And that is very common.
It also affects the adults.
Yeah.
And that can, of course, cause wearing out of teeth. And there are things that we can make if a child has something like that, or they're not sleeping well. When a kid is snoring, you've got to investigate, why is the kid snoring? Sometimes the airway is constricted, and yes, there are things the dentist can do. There are things we may refer to other specialists, but there are things that we can make. Appliances that we can make for the kids to wear, and they correct some of these problems. Things like tongue tie. There are kids who will have a tongue that is tied. I think it's a common thing. It has a name here in Uganda, but the tongue tie may limit the way the kid sucks, may delay the kid from talking. And then the parents will wonder what is happening to my child. So you may find that some of these things, when you again visit the dentist, they say, but it's a tongue tie. It's limiting the way the kid can maybe suck properly. Okay? And so once it is released and freed, then the child will be fine and will be able to move around.
Is that what they call a kanyata in Uganda?
Yes, that's what they call a kanyata in Uganda, yeah. So you have, of course, trauma is a big thing as kids play around, and of course we advocate for safer places where kids play from, playgrounds that have sharp objects and pavers and whatever, where they may fall and break their teeth. It's a very big concern. Now, trauma is a whole topic on its own that can be discussed on its own. But what is important is that for children, the baby teeth, when they get trauma, you are not supposed to fix them or do anything about them. So when a kid's tooth is avulsed and it's displaced from its position and it is bent or whatever, you're not supposed to be fixing it or putting it back or something. No, you are not allowed. As you try to do that, it may affect the coming permanent tooth. Okay, so we advise that you leave that, you go to the dentist. He may manage the trauma of the soft tissues and leave the the primary teeth alone. Eventually they will sort themselves as the other adult teeth are coming. But if you got, because you have the baby teeth in the back, and then you have the permanent, because these front teeth, you first get the front teeth at the age of 6. So you may have mixed dentition. So you have lost your permanent tooth. If it's a permanent tooth, we advise that you put it in saliva, okay? You put it in milk, and you rush to the dentist. The dentist is able to put it back, and you can actually have your tooth replaced. Because when you lose it, definitely the implication is too much. The replacements are not all that easy. The better options like implants are very expensive. So it's better if you can actually have your tooth put back. But many people may not know that.
Exactly.
It will just be avulsed and you throw it away and you think it's a gone case.
And talking about these problems, because I should say whatever you've talked about is really common, and a parent out there watching us should confess some are even experiencing whatever you've talked about. But let us look at the management. You've already told us, especially those when you lose a tooth, don't panic. You've told us that it is possible to replace it. But what about these other problems you've talked about? How can they be managed at a home level before we come to the dentist? And when we come to the dentist, what should we expect?
Yeah, so mainly, like I've shared, it's important for you to know what you should do.
Yeah.
In terms of cleaning the teeth, and mainly cleaning the teeth, because whether you're having the baby dentition, the milk teeth, or you're having the permanent teeth, it is important to be able to do the cleaning. Of course, the baby, the mother helps, or the parent, or the father, whoever is at home. You're able to go behind the child, okay, and still help them. They are in front of you, you are behind them, and you're able to clean their teeth.
You don't squat in front of them.
No, that's a bit difficult. It's better if you're just behind them and you help them clean. Now, we encourage you to just make simple strokes on top of the teeth. You know, last time I discouraged people brushing horizontally,
yes,
in the sides of the
which
teeth.
Is very common.
Yeah, it's very common. But you're saying on top of the teeth, make your gentle stroke, and you can teach them, the kids, and they will enjoy it. Say, do 1, 2, 3, 4, 5, back and forth, 8 times each quadrant. So they do 8 up here, they do 8, they do 8, they do 8, and they clean their tongue and they are finished. Okay.
At what age can they start this?
So we're saying as soon as the teeth come into the mouth, that is 6 months. Yes. As early as 6 months, a kid should have a toothbrush.
Are there special toothbrushes for the babies?
Yes, there are small toothbrushes for the baby, and we are saying they are also toothpaste for the children. Oh. Now, if you don't access this toothpaste for the children, you can use the adult toothpaste. But you're saying use a pea-size toothpaste. Don't put entire toothpaste like an adult. That's going to be too much, and it may have also its own challenges. Have a pea size. Just put on the tip of that toothbrush and let the child brush, or help them to brush. The baby toothpaste is flavored, so of course it helps the child to like. They are looking forward to the banana flavor, the vanilla or whatever flavor. And that kind of creates that culture of them to be able to brush. And so that's why it's important, especially kids who like sweets. Make sure you can use that as a bait and be able to introduce them to brushing.
Okay.
Yes.
That is very, very interesting.
Yes.
Now, we are talking about management. And so besides brushing, what else can parents do at home, especially when we look at the problems you shared with us? However, let's take a short commercial break. When we come back, we are going to get into details of that and how we can prevent some of these. We are taking our children back to school. Now, in such a situation, we need to know the do's and don'ts before we send those little ones back to school. Please stick with us. We are discussing dental health, especially in children. We are talking about some of the dental problems or dental challenges they get and how they can be managed, but not forgetting that since most of our children will be back to school end of this week or early next week, it is important for us as parents to really pay attention to this, because some of the things we already have on our lists to purchase for these little ones are the reasons they'll have these dental problems. So it is important that you pay attention to this discussion. And just in case you have just joined us, this is a discussion, and we are talking about dental problems or dental diseases in children. A doctor had told us a series of problems that the children experience. Doctor, we have children who are in baby class, who are given juice, and all the time they'll take the juice and they want juice, especially not actually natural juice. This is processed juice, and a parent buys a jerry can, so they dilute it so that it can last for some days. Some are even given this juice to take to school, and I believe this is also not right. And yeah, we are talking about the management and the prevention. There is what we call a dental home concept. Can you take us through this dental home concept as we talk about the preventive and management measures of dental problems among children?
Thank you very much. All our viewers, it's important to understand the dental home concept.
Yes.
The dental home concept is a concept of introducing children before their first year to the dentist, and to develop a relationship with the dentist that will be ongoing, okay? So that if you bring your child to the dentist and they have no single tooth in the mouth, the dentist is able to check the soft tissues, those parts where the teeth are going to emerge from, and see if they're healthy. That's where we would eliminate the other problem of false teeth removal, evinyo, you know, all these myths would be dissipated, and would have issues to do with developing that relationship, the child beginning to trust the dentist, beginning to like going to see the dentist for cleaning and things like that. That relationship should be the basis for a continued relationship throughout life. Because here in Africa, we have a problem where you only go to the dentist or to the doctor when you have a problem. When
it is even severe.
When you have severe. And so we're saying, no, that's not a good practice. A good practice is to take your child early enough. And when you walk with the dentist, he's able to advise you. He's able to tell you the things we were talking about, like how when you're doing bottle feeding, for example, what is the impact? How do you clean with a cloth, you know, before you introduce a brush? How do you do the brush? How do you now start toothpaste, you know? And how do you control it, you know? Because you've got to make sure that you're controlling it. So things like that. But that journey helps the child not to be foreign to the toothbrush later on. Because the people where they pack it for them in the senior one, but he keeps forgetting it because that's not been part of his journey. You know, it's a requirement at school, yes, but when it comes to using it, so we find that actually many children we see in dental clinics today, they have toothbrushes, but in their cases, they go with toothpaste, come back with it. But they're not using it because it's a foreign concept. And so,
and the funny thing is, the parents only appreciate them for being so for being so conservative that they've even been able to bring back some, not questioning why they have brought it back.
You see, and so it's important to be able to have this child start a journey earlier, and when they start the journey earlier, most of these things can be looked at and prevented. When we talk about things like thumb sucking, all these, even tongue thrusting and grinding of teeth, these are things that will be identified as you go early and can be rectified. Of course, if somebody is unable to stop on their own, or we have things that we can make. Say we have appliances like we can make, like a parato crib is something that we can put for a child who is sucking the thumb or is having difficult controlling sucking the thumb. So that will help to control that problem and therefore stop malalignment, you know, because if you continue, then you are going to have funny teeth. So things like all the things that we've talked about, whether it's the gum disease, it's the caries. Of course, we have advanced cases of tooth decay, like something called cancrum oris, or gangrene of the face, which happens in children who are malnourished. And actually, when these children come to the dentist, by opening the mouth, sometimes the things you see, if it is like oral candidiasis, if it is, which it is an indicative of something that is going on in the body, that sometimes you have not paid attention, or there's just redness, you know. It could be or bleeding easily, you know, or some patches in the mouth. All these things on the soft tissues, on the hard tissues, they're able to now communicate to you. So it's part of prevention to be able to see the dentist early. And these routine checks by schools, I think, are a very good thing. Though, of course, I think many parents will misuse it. They just go for the signature. They're not interested in the actual screening in order for them to be able to... I observed in some of my past work that communities where I used to visit and screen all the children, for example, in a school, and I went like 2-3 times. If I treated 90% of the children in this year, next year it would drop to like 60, 30, and so forth. So I've witnessed that screening and eliminating some of the challenges that are present is good and can actually help to control some of these problems. Okay. You have issues to do with the people, for example, having those or taking chemotherapy treatment for cancer. They need to see a dentist because, as I said, reduced saliva will have an impact on their dental health. And so we have stimulants, we have things we can give that can be able to bring the saliva. And so we can give them as things you can take and in other forms, then that can help you. Of course, we have things that we can do like dental sealants. So these teeth are not straight, are not flat. They're a bit rugged on the surface. And that is something that is important for chewing. Because if they were flat, it would be different. Food would be sliding. So they're a bit rough, but that roughness can be a retention point, okay, of food. And you may fail to clean it because it is not as easy as just when it is straight and flat like this surface. And so sometimes when you have those deep fissures and deep pits, it becomes hard for you to clean. So when we see that, we sometimes put a dental sealant. There's something we can put to reduce them so that it's easy for you. And it's a preventive way. There are things like fluoride vanishes. A fluoride vanish is a concentrated product, more than maybe the toothpaste you use at home, and the dentist can use it to varnish your teeth. It is in different forms. You can apply it, and that application can give you protection for about 6 months, and then you go back. There are others for those who already have destroyed teeth. There are things like SDF, which is a stronger chemical that has fluoride, that can silver diamond fluoride, which can help to arrest the caries. So you may have the tooth is already damaged, but this will now arrest and it does not continue to be destroyed altogether, which is different from the things that are being sold on the market, which are pain relief, they relieve pain, but they may not actually help in removing the problem. So here we're saying some of these can arrest the process of decay, okay? So they do not continue to disintegrate and break down. They arrest them, and then the dentist can now build them up, okay, for you. And so visiting a dentist is very important, in addition to the things that you can do at home, that we talked about, brushing and observing and opening the kid's mouth to be able to see what is going on, what is strange, as they're trying to remove those baby teeth. Sometimes these days, because kids are eating very soft foods, it's not like in the past where you're exposed to sugar cane and hard foods, and as you're eating those hard foods, teeth are coming out on their own. Today, you find that adult teeth are coming on top of the others. The milk teeth are stubborn, they're adamant, they're remaining there. But largely because of bread and soft foods. And so you find that if that is the case, in some instances, it may pain, but the child will not know what to do. So if they stop using that side and use the other side. But when you stop using one side, it again accumulates a lot of plaque and may actually also have other challenges. So all these things are things that we think that when you visit the dentist, he's able to identify some of these things. So in addition to your efforts at home, then you'll be able to control and have them sorted. Then you can start on a clean page. Only going for routine cleaning. Because routine cleaning is so important. It's like servicing your car. You cannot say, this car, I bought it, it's okay, you just drive the rest of your life. No. you've got to go back and keep changing the oil. A time comes. So a time comes and you've got to go for a professional cleaning, what they call scaling and polishing. And that, when you do that, as they're doing that, they are also looking at other problems that you could have. So you get advice. If there was a filling that was done and now it's failing, because fillings can fail. It's not that when you put them, that's the end of it. So you put a filling and maybe it is developing another problem on the side, or it is breaking, or, and so that can be rectified. So you find that somebody who visits a dentist regularly will have better teeth than those who ignore and just leave it to whoever it may concern. That's my take.
We are still looking at prevention, but on that point of visiting the dentist, one, if a parent has a child who has their milk teeth or baby teeth black, in Luganda they call it okusirira amanyu. So if I can put it like that, so if they have that challenge, is it that when the milk teeth is removed or uprooted, the permanent teeth will be okay, or the effect will even be transferred to the permanent teeth?
Yeah, so largely the baby teeth will be affected and the permanent teeth are safe.
Okay.
There will be in very few instances where they can also be affected. Okay. Now that's why we don't want the baby tooth, of course, to have like infection, to have abscess and pus, because that infection can actually affect the follicle and the developing tooth. So we wouldn't want anything. And that's why we're also saying things like trauma. We wouldn't want you to begin fidgeting with that baby tooth. It could affect that developing follicle as it is coming. So, and any injury will be significant when the tooth finally comes out. You'll see that the color has changed and so forth. So it is true that most of the baby teeth, they may be discolored, they may have problems. When they come off, you have a chance of having the permanent teeth, which are okay. There will be only a few instances where the problem can actually continue and affect the adult teeth.
Okay.
Yes.
Secondly, still about the baby teeth, some parents tend to panic when they see such challenges. Maybe the teeth is disintegrating, or maybe they have that effect and the plaque and all that. Is it that they should rush their children to the dentist so that the teeth is uprooted by the dentist, or they should wait and follow the normal natural process?
The ideal thing would be to follow the natural process.
Okay.
So, because as I mentioned, there is a reason why God put these baby teeth, and the reason they keep coming out in phases. Now, when you remove them early, especially their teeth where when you remove them, the baby molar, what we call the baby molar, the permanent tooth, which comes around 6-7 years, will assume a forward position.
Yeah.
When it assumes a forward position, it reduces on the space, of the permanent premolars and the canine. These come much later, at the age of 10, 11. Now, when these teeth come out so early, it means that the space is going to be utilized by other teeth. By the time the canines come, they don't have space. So that what we call the leeway space. That leeway space is so important that you need to preserve it. And the baby teeth are there to do that job. So coming out early sometimes brings that problem alignment, because the other ones will come, it will find a large sitting room, sit anyhow. So when it assumes, they relax. Now, when it assumes it takes that forward position, then the other teeth will struggle. That's why you find now people have those teeth, they are on top of the others. Especially the canines, they come and they it's on top of the others. And then parents struggle, panic. Sometimes they rush, they remove the wrong tooth. They now remove the canine which has come. Whereas, because there are such problems which are people, depending where they have gone, they remove now the permanent tooth, they leave you into problems. So all these issues we're saying, if you are actually keeping good oral hygiene, the teeth will begin to come out in the proper sequence. Okay? The age of 6, these front ones come out. You know, each other year there will be teeth that will be coming out as the others are replacing them. But when they fall sick, definitely, and they're having pus, they're having abscess, we fear this infection can, of course, give you other challenges. We take the teeth out early enough, but it has a problem. Unless you actually put something that can keep that space.
Okay.
You know, because we have some space maintainers. If you do not put the space maintainer to keep that space, then you may lose that space, which is crucial. And then you have malalignment.
Okay.
And malalignment is now a very big problem for many children.
And very common.
And very common. And it is largely because of sometimes that disruption, among other problems. Because it's not the only cause. But you'll find that that problem where the teeth do not have enough space, they get crowded. Okay? And you have also others where the jaw relations are a problem. They are not well aligned. You're having others where the jaw is small, the teeth are big. Maybe they inherited the teeth from the father, the jaw from the mother. There is some disorganization. So you find that sometimes all these can also lead to this crowding and all these issues that lead to malalignment. And we have very many people with that, children with that problem. And of course, it affects their self-esteem.
Yeah.
It is a challenge with at school if they are laughing at them. You need to make sure that you can fix it. And so that's something that will be fixed with braces.
Oh.
Okay. Yeah.
Okay.
Fixed with braces.
Still, on that, there is also another concern where a child removes the milk teeth, the baby teeth, but the adult teeth or the permanent teeth take long to come up. What causes that?
Yeah, so when you remove the baby teeth, they are actually like the light for the permanent teeth. They also give some direction. They are there to guide the permanent teeth. So I'm using a scenario of one car doesn't have lights, you are depending on the other one in the front. So when the other one that you are depending on disappears, so sometimes that is a problem. That when you lose those baby teeth early, age of 2, 3, you are losing the baby teeth. And it happens. There are many kids where they are obsessed, you have nothing to do, you take them out. That sometimes will cause delay in the permanent teeth, the way they come out. Okay? So, of course, it is important that the teeth can be kept up to the appropriate time. And they guide their the predecessor. Okay? So, once you do that, you find that, of course, there are other challenges that can cause teeth that get impacted.
Yes.
We have like canines. Canines are very big teeth. They come from all the way up, almost around the eye. And they have a very long journey to come to where they are. Okay? So in that long journey, sometimes they may get trapped. Okay? And then the other teeth are there, the canines are not there. But they're up there trapped. So, of course, dentists have a way we can do surgery and bring them into the mouth. They are also, and both up and down, they can all be trapped. Then the behind teeth, the wisdom teeth, also get trapped. So you can wait for them, and they never show up. And maybe you're saying at 20, 23, you're supposed to be having them. You're 25, you have not seen your wisdom teeth. So those teeth which come are late sometimes. The others may take the space, and they also don't have enough space where to come to. So they will get impacted. But there are other factors that may also cause them to get impacted. Because they're always at the angle of the mouth. So they can also be trapped in the bone there as they're trying to develop. So all those are issues. And most of actually the impacted teeth can be a problem and may need to be removed, okay, in most cases. Because the way, if they remain in a funny position and they're causing food impaction, they're causing the neighboring tooth to fall sick, sometimes we take them out.
Okay.
Yeah.
So after how long should a parent now start fearing that there could be a problem between the time that the baby teeth is removed and the time they should expect the permanent teeth to have developed?
Yeah, well, of course, this process of having permanent teeth stops about 12, 13 years. So if you're having a 14-year-old child and there are some teeth which are not in the mouth, visit the dentist to check. We'll take some x-rays and be able to see, are those teeth there? Because there are situations where the teeth may be missing, and they are not there. They may fail to be in the mouth.
Like naturally, it wasn't created.
Yes, it is not there. That also happens. There are those who have many. They develop many, like 2 canines or 2 whatever. So maybe you are seeing one, but another one is somewhere. There are those where it's a they have like what we call pegged lateral teeth. They are very small and funny, very tiny. The other teeth are okay, but that one is very tiny and small. So all those issues, they have also things that can go wrong. But when they delay and they're not coming, or they're coming in a funny way, at the end of the day, you still have to visit the dentist in order to be advised on what to do.
Okay.
Yeah.
So we shouldn't take things for granted. Yes. Now, that's what I'm realizing. Now, Doctor, we can't complete this discussion minus talking about the back to school requirement lists. Parents always give their children liberty to write lists, write whatever you want, and then all the parent does is to buy and make the child happy. What are some of the things parents should avoid, especially at such a time when they're planning to take their children to school? One, to save their money, but most importantly, to save the teeth of their children.
Yeah, of course, that's a hard question. And I don't think that they will listen to me in terms of advising on what they should buy and what they should not buy. But my take is that we should limit, because when I use the word limit, at least it is more bearable than if I say don't.
If so I was to buy 3, I buy 1. Yes. I'm limited.
So let us limit sugary foodstuffs. Okay. And by the way, they do not only affect teeth, they affect the whole body. But sticky foods, sticky processed foods are very dangerous. So people, if you pack sweets for your kid, you pack biscuits, you pack all these processed refined things, they are sticky, they stay on the teeth longer. So if the kid is, and they are easier to be processed by bacteria. Bacteria also doesn't like rough food. So it also likes this processed fine sugar. So when you pack them with a lot of that, a lot of splash, or whatever, then definitely you expect that cavities, by the time they come back, will be part of them, especially if the brushing is not adequate. And I can assure you that because they have just started that brushing habit, they have not been, because that's why I wanted to introduce the concept of dental home. It has not been part of them. Now, you don't expect that even in your absence, when you are not there, that they're going to help themselves. So pack all those sugary things that really at the risk of knowing that these teeth may be affected, and in the holidays, there may be business of now filling or almost all the teeth. And it's been absurd. You've seen some kids where you find almost all the molars are affected, and you've got to make fillings. We have 32 teeth. You have about 20 teeth are filled. It's really sad. And it should be a concern for everyone, and we should make sure that we fight it.
Doctor, what are your parting shots pertaining this discussion as we wind up this whole discussion?
Really, me to thank all viewers and all our supporters, those who come to Run Dental Clinic. I want to thank you, and to say that the concept of the dental home is so important and pertinent to me, that we let us introduce children to the dentist as early as 6 months before they make the first birthday. Then we'll establish a relationship with them. We'll begin to work with them. We'll begin to introduce brushing. We introduce other components, other things about cleaning early enough. When that is achieved, you won't struggle to tell your kids to brush, and they have failed to brush, and then you'll prevent quite a number of things, because you see that all these dental problems, we are rotating around cleaning, we are rotating around removing that plaque, we are rotating about disorganizing the bacteria, not giving chance for it to form, for it to accumulate and work. And so if you are to disrupt it, the brushing and cleaning is really very important. And so that has got to be started early. and I want them to embrace that concept of dental home. Thank you very much.
And thank you so much, Doctor. We are indeed grateful. And when you go back to run dental clinic, you send our regards to all the entire team and the whole team you work with in Run Foundation. We are grateful. Thank you so much for the insights. And to you, our viewer, it's been a pleasure having you tuned in from where we started from up to now. It's time to go, but just remind you that Family Hour will show up even tomorrow, where we talk about family finances and wealth. It is important for you to know how to start and why you should start a family business. Now, how do you do that? Just watch tomorrow's Family Hour episode. Trust me, your life will not be the same again. Edwin Austin Mukalazi is my name. I've worked with Brinko Ategeka, Enzara Yechegegwa, Didmas in transmission, Jonah Jao, the producer, and very many other people who put up everything together to see that you see this image. God bless you. We meet again tomorrow.